general observation of your abdominal area. Do you have any like pain when I palpate anything here? Okay, I don't see any abnormal tone or color or any atrophy in your abs. Let me go ahead and palpate, looking for abnormal warmth on either side. Okay, I'm also going to look at your ASIS, make sure they're even. Okay, all looks good here. Can you go ahead and turn around? We're going to do something similar back here, looking at your paraspinals, feeling for hypertonicity on one side or atrophy on one side. Also, we're looking for any kind of lateral shift of your hips or in your lumbar spine. Okay, and now I'm going to palpate PSIS. Make sure those are even bilaterally. They are. Good, and then your iliac crest, I'm going to kind of rest my hands here. Those look even as well. And again, back here, I'm looking for any kind of bruising, warmth, abnormally on either side. Okay, so next, what we're going to do is we're going to start testing your range of motion and your strength in your lumbar. So can you go ahead and touch your toes? Good. And I'm going to take you a little further. Any pain with that? Okay, and go ahead and push up. Don't let me move you. Okay, go ahead and come up and grab your hips and go back. Okay, any pain there? Pain with this? Okay, and come back straight. Don't let me push you. Okay, let's do side bending. Can you have your hands next to your side? Let's do right side. Right hand to right knee. Any pain with this? Okay, and come out a little bit. Don't let me push you. Same thing with this side. Pain with this. Okay, come out a little bit. Don't let me push you. Okay, good. Strength is within normal limits. Let's go ahead and test your S1 key muscle for your gastroc. So what we're going to do is have you get on one foot, do as many calf raises as you can, okay? With this, we're testing one leg at a time. Within normal limits would be 25 reps. Within functional limits would be 10 reps. Okay, let's say you got to functional limits at least. Let's do the other leg. Okay. Good. Okay, nice. Can you go ahead and have a seat here? We're going to start testing your deep tendon reflexes, starting with L3. Good. Good. Can you slide that way a little bit? I'm going to do S2. Bicep femoris tendon. Okay, can you point your toes up towards you? Moving on to L4. L4 on the left leg. Point your toes up. Relax. Good. Bring up this foot. One more time. Okay, relax. This is L5. Good. Point your toes up towards you. Relax. Good. Do S1. Good. Okay, no burst movement here, no absent reflexes, just within normal limits. Okay, and now we're going to go ahead and move on to your upper motor neuron test. So we're going to do Babinski first. I'm going to just bring up your foot here. It's going to be a little bit painful. Okay, that's down going. We're looking for any extension of the first toe, the great toe. And same thing here. Okay, that's negative, down going. And now we are going to test Clonus. Looking for abnormal beats, which should be above 3 beats. Normal should be 1 to 3 beats. So I'm going to check, make sure you're not painful. You okay with that? You okay here?
Yes.
Okay. Okay, that's normal on both sides.
Okay, so we're going to do a neurodynamic test. So it's called the Slump Test. So at any of these positions that I put you in, I want you to tell me if you have a reproduction of any of your familiar symptoms. Okay. So go ahead and slouch your back. Good. Any symptoms? Okay, now bring your head all the way down. Good. Any symptoms? Okay. Now I want you to extend this leg. Any symptoms?
No.
Okay. Now bring your toe towards your head. Any symptoms there?
No.
Okay. You can go ahead and relax and sit up straight. Now we're going to do the other leg. Okay. Now slump your back. Good. Now bring your Head all the way down. Any symptoms?
No.
Okay, extend this leg. Any symptoms?
No.
And bring your toe towards you. Any symptoms there?
No.
Okay, you can relax. So if he felt any symptoms, we could relieve it and see if it was better if he moved his head back or if he relieved tension on the other end of his foot. We could just see if it was positive that way too. Okay, next we're gonna do dermatomes. So I'm just gonna tap you with this cotton ball on different areas on your legs, and I want you to tell me if they feel the same or equal. And if they don't, then you can tell me. So you can close your eyes. L1.
Same.
That was L2.
Same.
That was L3.
Same.
That was L4.
Same.
That was L5.
Same.
That was S1.
Same.
And that was S2. Okay, good. Now you can go ahead and lie down for me. Now we're gonna do key muscles. So first we're gonna do hip flexion. So go and bring this knee up towards your head as far as it can go. Good. Do overpressure. I'm gonna resist you here. Don't let me move you. Good. Now I'm going to resist you here. Don't let me move you. Good. Relax, and then we could assess his hip extension. We can see his normal hip extension there, the way he's lying, and then we'll have you bring your heel all the way to your bottom, as far as it can go. Good. Overpressure, and then extend the knee. Overpressure there. Good. I'm gonna resist you here. Don't let me move you. Good. Now hold your leg here. I'm gonna resist you here. Don't let me move you. So testing the extension and flexion there. Good. Relax. Now I want you to bring your toes towards your head. Good. Push you a little further. Good. I'm gonna resist you here. Don't let me move you. Good. Now I want you to bring your toe to your head. I'm gonna push you a little further. Good. I'm gonna resist you. Don't let me move you. Good. So same thing. Bring this knee to your head. Hip flexion. A little overpressure. Good. Now I'm gonna resist you here. Don't let me move you. Actually, go ahead and scoot this way for me. Or do that one again. Okay. Don't let me move you. Good. I'm gonna resist you here. Don't let me move you. Good. Bring your heel to your bottom as far as it can go. Good. Overpressure. The extension, flexion. Good. Now hold your leg here. I'm gonna resist you here. Don't let me move you. Good. I'm gonna resist you here. Don't let me move you. Good.
Alright, so first thing we're gonna do is straight leg raise. So we're just gonna extend the leg, I'm just gonna rotate, aid you up a little bit, and raise you up. Anything with that?
No.
No? Got it. Okay. Same thing here. And we'll add some dorsiflexion as well. Doing okay?
Mm-hmm.
Good. Okay. And for that, we're just looking for any limited range of motion between 0 to 70. And we're gonna do your pulses. So we'll start with posterior tip. Good. 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 2+. Okay. Next thing we're gonna do is your SIJ distraction. So I'm gonna palpate for your ASIs. And this is a provocation test, so we're seeing if you have any reduction of familiar pain or any pain at all. Okay. So apply some pressure. You okay?
Yep.
Good. Okay. So for that test, we'll normally hold for about 30 seconds, but for the sake of the video, I'm only gonna hold for a few seconds, but that's how we would perform it. So let's go and have you lay on your side facing that way. So it's SI distraction, we're gonna do SI compression. So I'm gonna apply some force here in the superior part of his pelvis. I'm gonna come down. Any issues there?
No.
No? Good. And same thing for that one, we would hold for up to 30 seconds, but for the sake of the test, we're just gonna hold, or for the sake of the video, hold it for a couple seconds, and taste the other side. Same thing. Good? Okay, awesome. Alright, so I'm gonna have you lay on your stomach, please. And over here, first thing we do is just test your femoral nerve. You okay there?
Mm-hmm.
Good. the other side. And with this test, we're looking for any reproduction of symptoms or familiar pain, whether in his anterior hip, anterior hip, anterior thigh, or along his femoral nerve. You okay? Good.
Yep.
Okay. So we're gonna go ahead and palpate now for his QL and his piriformis. First thing we're gonna palpate for is QL, looking for any obvious hypertrophy, asymmetry, or hypotonality. Any tendency to that?
No.
No? Okay, good. Not tender to palpation. Good. And then we're gonna go and do your piriformis. We're gonna come to the sacrum. We know that's on the anterior portion of it, going down to your greater trochanter. And again, we're looking for any asymmetry or any tender to palpation or any pain with that. We'll do the opposite side as well. Good. You okay?
Yep.
Good. Okay. And lastly, we're gonna go ahead and do PAs. So we're gonna find your 12th rib. Work our way up. Start at T12, T11, T10. Start at T10. 11, 12. We're gonna go L1. 2, 3, 4, L5. Good. Any pain with that?
Nope.
So essential PAs, we're just looking for provocation of pain. And with that, that's going to conclude our lower quarter scan.